Thank you, Dale. Now we move to Magnus Lindelow at the Global Program for PPR of the World Bank in Washington, D.C. Please, Magnus.
Right. So first of all, thanks for the organizers for pulling us together. This is an amazing week. Really appreciate the opportunity to be here. So I'm going to talk about the financing agenda for pandemic preparedness and response. I think it's going to naturally link to some of the earlier discussions and presentations and probably some of the ones that follow as well. We're in a session on international cooperation. I think financing preparedness and response is inherently about international cooperation. It's partly this is a global public good agenda, but it's also an agenda where there's quite significant development assistance and support focused on low-income countries and low-middle-income countries. And there were a lot of gaps that were highlighted by the COVID pandemic, both in preparedness and response capacity, and there's been a lot of attention with some successes through the Joint Finance and Health Task Force, the establishment of the Pandemic Fund. And this is a really important agenda for the World Bank as well. At the moment, I think we have around $5 billion of financing for low-income and low-middle-income countries, specifically for preparedness, covering 50 or so countries. So it's a significant financial commitment and important priority. So maybe just to start, I'm an economist, I'm not a scientist, so I feel a little inferior in this crowd, but I'm just to kind of get on the same page in terms of the language, what we mean by preparedness financing, and really what we're talking about is generation, allocation, and use of funds for health emergency prevention, preparedness, and response. And there is the preparedness side, which is of course the ex-ante part, and then of course the ex-post financing in the context of response, with a range of actors that are involved in those efforts. So a key reason, of course, that we're talking about financing for preparedness is the fact that we've got a lot of capacity gaps. This is just the Health Security Index from 2021. It's sort of the lighter shading is lower capacity. This is not a surprise to anyone. It's striking how it's kind of effectively the inverse of what I think Dr. Fauci's presentation, where we saw the risks where we have the weakest capacities in this map. So this is really, of course, a key trigger why the World Bank is and so many other entities are working with countries and regional institutions to support this agenda. Now, an obvious question is how much money do we need to address some of these gaps? And that question, particularly after COVID, generated a whole cottage industry of costing exercises. And there was a very wide range of estimates from 10 billion, we got some of the main sort of studies at the bottom there, but ranging from 10 to $50 billion a year. Now I think HLIP, you landed at 15 billion, right?
When you look at GDP, we landed at 100 to 200, but you should keep going.
All right. And so, you know, there's a wide range for a host of reasons. This is inherently very, very difficult. There's no standardized methodology. What do we mean by PPR activities? How broad do we go? Do we look at sort of the more the front loading or longer term? Is it really about investment? Are we also thinking about current spending, et cetera? So it's challenging, but that is a sort of one estimate of need. We also have the National Action Plans for Health Security, which are the country-based efforts to plan and cost financing needs. The challenge there is of course often that these are fundraising instruments. They are also in a context, particularly in low-income countries, where there are a lot of different stakeholders involved. I read one for a low-income country in the Africa region recently. There were 22 financing partners that were anticipated. And a lot of the the process is oriented towards development partners rather than something that is a domestically oriented exercise that engages Ministry of Finance and other stakeholders. The other point, just to kind of highlight, of course, is that a lot of that costing we're talking about is really about the health system. We've discussed today about the fact that there are a lot of financing needs, certainly in a response phase that go beyond the health response. That is about the sort of fiscal surge, being able to provide support to vulnerable populations, etc., all of which have some implications also in terms of thinking about this as a preparedness agenda and the investments that are associated with that. So that's a need. How much financing is available? So there aren't a ton of great data on this. We can thank IHME for some of that. We can thank OECD for some of those data points as well. Those sources aren't entirely consistent, again, for lots of good reasons, given the complexity of this. But what's striking is that if you're looking at the sort of dark pink, I guess it is, color there, that's really what is referred to in the data as other infectious disease. And we're looking sort of pre-COVID and now post-COVID of somewhere in between $1.5 and $3 billion a year of development assistance. On top of that, you have HIV/AIDS, TB, malaria. Of course, that's relevant, and some of that is about preparedness, but much of it isn't. So we're clearly quite a long way in terms of development assistance from the 15 to 50 billion that has been estimated. The other question that was touched on in earlier presentation is the question, what about domestic financing? How much are countries spending? And the reality is that we really don't know. And again, we don't know for some good reasons, because it's very hard. Most budget systems, most chart of accounts don't map easily to preparedness and response capacities. The bank actually did a few studies that involved sort of quite extensive work with different ministries, with local governments, to really try to map this out. What we found through those studies is that there are a very broad range of ministries that are involved, but most of the financing was really through the Ministry of Health. A lot of the spending in those countries, this was Vietnam, Indonesia, Pakistan, was at local government level. And the central government spending was really about the immunization program, so really about prevention. And quite low levels of spending. And for these three countries, these ranged government spending somewhere between $2 to $4 per capita. So it's pretty modest. And of course, I mean, we've touched on this in various ways, that we are in a sort of somewhat gloomy situation at the moment, both in terms of domestic and international financing. This is from a forthcoming report by the World Bank that is looking at both domestic financing for health. This is not specifically PPR, but domestic and international financing for health. The left panel is low-income countries, and it's showing, I'm sorry, it's a bit small, but it's showing in the light gray or light blue, that is development assistance, and the dark blue is domestic budget financing. It includes on-budget international financing that, like the World Bank, for example, would be on budget. And so if you're looking at the low-income panel on the left, and the sort of the dotted blue line is basically a UHC benchmark level of spending, what's needed to reach UHC. So what you can see here, again, this is not PPR specific, but in low-income countries and low-middle-income countries, spending levels are far below UHC benchmarks. In low-income countries, overall spending actually declined between 2018 and 2024 in real terms, and is projected to decline further by 2030. And this is looking at growth and revenue, expected growth and revenue, and with a fixed budget allocation for health. And in the case of low middle income countries, you're looking at very modest increases between 2018 and 24, and also modest increases to 2030. So clearly not a prospect for massive expansion of domestic financing unless there is a sort of reprioritization within government budgets. And then I wanted to sort of say a word also, so far I was really talking about preparedness. I wanted to say a word about the response financing side. As I was saying earlier, a lot of that is about the health response, but there is also enormous financing needs beyond the health response. I think if you look at high-income countries in the context of COVID, many countries spent more than 10% of the equivalent 10% of GDP on social program and fiscal stimulus and support to businesses. So that's just one example of I think, the importance of that beyond health. The other piece that we sort of, in terms of looking at lessons from COVID, was that the lack of fiscal capacity, of course, in low and low middle income countries for that response, the health response, but also the broader response. But also on the domestic financing side, big challenges in terms of actually using domestic budgets for response activities. It required emergency funds being available, but also emergency procedures, the ability to procure in an emergency context, and for those decisions to be made. There's huge risk averseness around large procurements, so this was a constraint in many contexts. On the international financing side, one of the conclusions that I think others will speak more about, but that was discussed extensively in the work of the Joint Finance and Health Task Force, was just the lack of scale and the lack of speed in international financing being mobilized and actually deployed in the countries that needed that financing. And significant coordination challenges. We had different procedures, different rules, different financing that was eligible across development banks, donors, etc. That created, I think, significant challenges for countries. Of course, we've talked about medical countermeasures, the case of vaccines, the difficulty or for that low-income countries and low middle-income countries had in entering early procurement or advanced purchase agreements for vaccines, and the inability of other organizations, including the World Bank, to do that on behalf of countries. And the chart here is just showing the date of and the doses per capita that was procured through advanced or secured through advanced purchase agreements per capita for high-income countries. And you can see, so a lot of that started in April, May, or even before, March, April of 2020, and the first COVAX contract took place right at the end of December, so 8-9 months later than when high-income countries started. So where does all of this leave us in terms of thinking about international cooperation? And I think there is a big agenda for us as international organizations supporting low-income countries, low middle-income countries on the domestic financing agenda. I think one of it is the sort of planning and budgeting. We had recently had at the bank Dr. Frieden come and speak from Resolve to Save Lives, and he talked about the vicious cycle of planning to planning, that there is a lot of planning, but those plans aren't necessarily anchored in domestic processes with the clarity in terms of the budget monitoring and budget performance, etc. I highlighted earlier the importance of actually monitoring spending and implementation. There are examples where we have been able to track expenditures, domestic expenditures for climate, for example, for nutrition, and there are opportunities to work with countries to do that. And I think looking at really assessing and strengthening public financial management capacities for countries to be able to respond effectively using domestic financing is a huge agenda that the bank is starting to engage with countries on. And on the development assistance side, just highlighting a few points. Sort of one, I think, is of course this challenge of continuing the prioritization of PPR spending and investment in preparedness, and I think we've heard from the Pandemic Fund it's a key instrument. We're also on the MDB side looking at innovative ways for countries to take up more of our financing for global public goods, including preparedness, and there are incentives for that to happen. And then I think also this question of really mainstreaming PPR and how we're supporting countries on health system strengthening. It goes very much to the primary healthcare agenda, Dr. Taj, you've highlighted, of bringing preparedness into all those elements. I think we have a big task ahead, and the operational playbook for pandemic response financing that we have worked on with WHO and others under the Joint Finance and Health Task Force has set out an agenda of really trying to simplify and align the instruments and the way that we work with countries on response financing. And finally, trying to address this issue of MCM access, the need to establish some form of scaled at-risk financing. And as was highlighted in earlier presentation, this is something on the World Bank side that we're actively working on, and we hope to get that done quickly. I took note of the non-trivial probabilities of future pandemics and hope we'll be better prepared when that comes. Thank you.